Welcome back. We're now going to discuss the challenges and benefits for the older worker. Some of the challenges include technology, negative biases, fewer opportunities, age-related changes, and fear. Some of the benefits include alternative work schedules, flexible work opportunities, and federal legislation protecting the older worker, such as the ADA, the Older Americans Act, and the Age Discrimination Employment Act. Before we spoke about the stereotypes that people have for older workers, in reality, older workers are typically more reliable and stable, more productive, require less supervision, are less distracted by other interests, have a stronger work ethic, and are more willing to work flexible hours. One finding from this 2012 research study was that older workers tend to be less likely to participate in training and career development. So who are young retirees and who are older workers? Typically, young retirees are considered individuals between 51 to 59. Most often, they are women, less educated, married, in poorer health, and are less well off financially. Older workers tend to be individuals 60 and older and are men, more educated, married, in better health, and more financially sound. These are just statistics that we see in the research, right? Like I said earlier, there are biases within our research, and we need to do better to get a better grasp on all different cultures and what we're seeing in older workers. Older workers tend to have less physically demanding jobs, and they're more likely to be in more managerial level jobs. Healthy retirees are much better off financially than someone who's not healthy and retires. Healthy workers are more optimistic about their future. Older workers rely less on income from Social Security and pensions, and those who are more likely to retire typically have some type of retirement plan. There are common jobs for older adults that I'll mention in a minute. Occupations employing the most older adults include archivists and curators, clergy, bus drivers, furniture finishers, jewelers, legislators, medical transcribers, and real estate brokers. This was taken from a survey in 2016. Here's just a visual to look at employment of workers 55 and older by occupation group. And again, this is from that same study in 2016. This is a chart showing the part-time employment of workers ages 25 to 54 and 55 and older. You could see ages 55 and older individuals are more likely to be in part-time employment positions. Later in life career options. With people staying in the labor force longer, planning for a career later in life may be increasingly important. Workers age 55 and older were employed across many types of occupations in 2016, according to the Bureau of Labor Statistics. More than 42% of these workers were in management, professional, and related occupations, a somewhat higher proportion than that for all workers. So what is OT's role in work for older adults? OTs can provide appropriate fit for older adults who are working. OTs can provide training programs for workers and employers, looking at what are their barriers to their programs. OTs can assist in implementing universal design strategies and principles. OTs can look at the ergonomics and assistive technology and do a consultation or a training. We look at health promotion and wellness, and of course, self-efficacy. Specific task education can be provided to employers and workers about different strategies they can implement within their workday. OTs help people consider environmental adaptations and modifications, such as lighting, the number of breaks someone is allotted, and consideration for all activity demands. Older workers, like I said before, tend to underuse development and training programs, but they need to maintain their professional competence. OTs can structure these types of trainings so that they are more compatible with older learners. Productive aging and work. So first off, what is productive aging? Productive aging is an approach that emphasizes the positive aspects of growing older and how individuals can make important contributions to their own lives, their communities and organizations, and society as a whole. In the context of work, productive aging involves providing a safe and healthy work environment for everyone through comprehensive strategies that allow workers to function optimally at all ages. So looking at the lifespan perspective, aging process is multidimensional, right? We know this from our first semester. It involves both losses, such as maybe some physical stamina, like I mentioned before, the physical endurance that some jobs require, but also gains, such as the accumulated wisdom that older adults have throughout their years in the workforce. The aging process is characterized by plasticity. So, for example, physical functioning may be affected by regular exercise, and neuroplasticity may be of the brain may increase with experience and different life events that someone has. The aging process is multidimensional, right? We're looking at biological, cognitive, socio-emotional, all subject to environmental influences. The aging process is contextual. So the nature of the work, how it is structured, type of workplace relationships, and specific events, such as the avoidance of disability, retirement, and career advancement play a role in productive aging. Families, friendships, community, workplace, and society influence productivity. Some concerns for workers. Thinking about the financial factors and the loss of income if someone does stop working. Thinking about pensions and retirement plans and support. Individuals, of course, need to consider their health and their health insurance and their time and activity level. These concerns are those that often lead older workers to head and plan for retirement, particularly those who need to contribute to pensions. There are definitely cognitive benefits of work. Research supports benefits such as the stimulating environment and the social context of the work environment. Research has linked high intellectual and complex demands and strong cognitive reserve. This supports the idea of mental practice and the slowing of cognitive aging. Negative impacts of work include effects of work-related stress and the link to cognitive decline, and the lack of job control or the high demands and lack of support. Work-related issues for older adults. Legislative and policy issues, like I mentioned before, the ADA. We're also thinking about workers' comp, and like I said, the Age Discrimination Employment Act. Of course, we're still thinking about an interprofessional team. So OTs, PTs, social workers, rehab counselors, all thinking about the older worker. Rehab counselors help assess for work-related skills, identify work opportunities, and provide counseling for workers and employers. Social workers identify resources and help clients access them. And case managers coordinate care among the different organizations. Lastly, let's touch upon the legislative and policy issues. Strengthen financial incentives to carry on working. Raise the minimum age for Social Security. Ensure disability benefits do not become an alternative route to early retirement. And limit tax advantages in private pension plans for taking early retirement. Remember that the earliest a person can start receiving Social Security retirement benefits is at age 62. If you start receiving retirement benefits at age 62, you will get 75% of the monthly benefit because you're getting benefits for an additional 48 months. If you delay taking your benefits from your full retirement age up to 70, your benefit amount will increase. Medicare benefits start at age 65. So I want you to ask yourself, what is a realistic retirement age for most individuals? And how is that different between all different cultures and different jobs?